You have several documents in front of you. The first three are all policies related to a medical emergency. That's the first thing we're going to talk about tonight. And then the second thing we're going to talk about is a weather emergency, or the water isn't running, or we don't have power, or things like that. So that'll be the second thing we briefly go over. There is a quiz. It's short and easy. At the end, there's a quiz for non-clinical staff and there's a quiz for clinical staff. So the first three documents that are in front of you, the first one is the policy on just managing the equipment. And the emergency equipment in our offices are O2 tanks and emergency carts. So each office has one of these. And this is just a policy on maintaining this. So clinical staff is checking this monthly to make sure everything's in there, that nothing's expired, and that the O2 tanks have O2 in them, that they have the masks that are supposed to be on there, and that they're functioning. You can turn them on, you can turn them off. And the third piece of emergency equipment is the eye wash station in the Long Meadow office. It's in what you used to call the treatment room. If you don't know how to operate it, that's really an OSHA thing. That's to save us, well, to anybody, but mostly us. So if you don't know how to operate it, see Emily or myself, because Emily has been checking that weekly to make sure that it is functioning. Thank you, Emily.
But I figured I'd take the thing.
So your responsibility in maintaining this equipment is clinical. And for the rest of the staff, it's to know where it is. So in the Long Meadow office, it's at the front desk, and in the Enfield office, it is
in the cubby way by the sink. I don't know how else to describe it. You know where the sink is? Everybody knows where the sink is?
Do the front lab.
Right underneath the countertop is the emergency kit. Right across from it directly is the oxygen tank. The eye wash station, though, is in the back lab where the vaccines are in the fridge.
okay. So it is your responsibility if you're a clinical person to know where it is and how to operate or find things in here. You will have an opportunity at the end of the in-service to have Katie demonstrate how to use the oxygen tanks, to go through the emergency car and know how to do the checklist if it's your turn to check it, and then to meet with Karen and Judy, who will be reviewing how to administer an IVQ and how to use an AMBU bag. So you'll go to 3 different stations and do those things. That'll be at the very end of the in-service. So that's pretty much all the first document is about. The second document is how to respond to a medical emergency should it present at the office. Most likely the first line of defense is going to be the front desk. Someone could come in and say, my child just ate a peanut, he's breaking all out in hives. My child, it doesn't seem to be breathing very well. It's an emergency. My 2-year-old, I'm holding them, is having a seizure. These things have all happened before. Luckily, this doesn't happen a lot, but that doesn't mean we shouldn't be prepared. So it's good to act out what your responsibilities are very simple and they are very common sense, but it's always good to act it out in a scenario like this once a year, so when it does happen, you know what your role is depending on what your job is at PVP. And there are scenarios when there isn't a physician in the office. And an emergency could happen at that time. An emergency with a staff member could happen. These are things that are good to know for ourselves, not just for our patients. So, I forgot the other piece of emergency equipment is the AED, which is only in the Long Meadow building. There's not one in Enfield. Just to review, if you go out the door where the lockbox is for the urines and everything, and you go down the stairs, on the right-hand side, there's a closet door that says AED. And when you walk in the door, it's right there. Okay. You open up the glass door, it just swings open, it's not locked in any way, and you grab the handle and you leave with it. You probably aren't going to need a PD one, but there is the PD part is in a box behind it that says PD. I think it's purple. All right, so as far as a general response to a medical emergency, there's the first 3 things that have to happen when someone comes to the door is, 1, to get a doctor or call 911 if there is no doctor present. If it's possible and safe to move the patient then into an exam room, That's what's gonna happen. And this may be a front desk person doing these things, okay? Someone into the exam room, and then to bring in the oxygen and the emergency cart. It's always those first 3 steps for anything, okay? We'll go over scenarios more specifically later on, but that's the first 3 steps. So everyone in the office should be able to identify an emergency, should be able to then enact an emergency system. When you call 911, you can't just say, Chrissy, call 911, and Chrissy runs and gets the phone, and they say, what is your emergency? And Chrissy says, I don't know. So you want to know what the emergency is, you want to know how old the child is and the condition of the child, and you want to know where you are. So you want to be able to provide the address, and then afterwards you want to assign someone to go wait outside for the ambulance and escort them into where the patient is, okay? So those things, everybody in this office should be able to do. The next step is the clinical staff's responsibility. And what their responsibility is to be able to find something that they may need in here quickly. Everything's labeled, you'll get a chance to review this box. They should be able to get an O2 tank and turn it on and administer oxygen if it's necessary. They should be able to choose which AVQ dose is appropriate, depending on the child's weight, and administer an AVQ. You can all do updraft, so that's not a problem. You should know what to do if the patient's having a seizure, okay? So those are the responsibilities of the clinical staff in addition to the other stuff. There are the next one are common emergencies that may present in the office. We'll only act out 3 of them, but the first one is seizure. We'll act that one out. Altered mental status. We're not going to act that out, but you should be able to recognize that this is not something that should wait in our waiting room. If someone comes in and says their child is confused, doesn't know where they are, is talking in delirium or gibberish, or is hard to arouse and seems that this person needs to get put into an exam room, a doctor needs to come right away. We need to be prepared that this could possibly be an emergency. So that's on there, we're not going to act it out, but recognize if someone comes to your window or you get a trick, you know, this is an emergency and this isn't going to wait, okay?
So can I? So when you're at the front desk, and you're bringing a patient into the treatment room, are we supposed to bring this cart and the oxygen into the room, or does the nurse get this switch?
We'll do that. What you're probably going to do if you're at the front desk, because we're very rarely nobody there.
Yeah, right.
So what you're going to do is say to a nurse, I have an emergency, or if a doctor's right there, a medical person, I have an emergency, and then that medical person can bring the patient in a room, and you can follow them with this cart and the O2, okay? Or there might be another nurse there who will join in. So hopefully you're not by yourself in that circumstance. But once there are clinical staff people there, then front desk staff and everyone can be available in case they need to call an ambulance, but they don't need to be in the room. We don't need a ton of people in there or anything like that. Anaphylaxis, we'll go over that. And asthma, respiratory distress is the same thing. So we'll really only go through 3 scenarios, and then you can ask questions if you want. But they're pretty straightforward. You're going to notice that you always do those first 3 steps. You always take vital signs, and sometimes you might need some oxygen or an AVQ or an oximeter, which I didn't bother bringing the oximeter down, but you ready? Okay. Yeah.
You're with me?
I'm with you. But you're not
That's
having
your daughter.
Tell me, you're already having a seizure right now.
All right, something's wrong with my daughter's seizure.
Here we go. Are you getting this? I need a doctor.
God, I can't take this.
What's going on? All right. Yeah. I'm asking her. Can you call 911? Get Dr. Camera.
Okay. All right. You got
We
it.
need to make sure she's on her side.
Oh, look at Dr. Camera for her. Okay.
Thank you, Ann.
Whoops. Is she okay? Okay. All right, so we're going to open it up. Ding, 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 ding. Hello. Yes, we have emergency. We have a child who is having a seizure,
How old
and we
is
need an ambulance.
How old is she? 6 years old.
She's 6 years old.
Does she have a known seizure disorder?
No.
This is
She had a fever.
High fever.
And the child has a fever, so please come to 123 Dwight Road. Okay, Sue Law, we need the ambulance.
You really want me to go inside?
Okay. Is she all better? Okay, so
No, I'm post-ictal.
You're post-ictal. Okay, so she'll be there for a little while.
Post-ictal, she's just gonna stay around for a while. She's not even gonna
We'll
respond to
just
anybody.
step, all right.
Oh, she peed in her pants now.
Usually if you call for help, a lot of people come, so you have way more than 3 people.
Right.
Right.
Oh, you
Right.
But
definitely.
like there'd be the other. Yeah.
But should you be alone and that happens, should there not be a doctor and it's just 2 of you getting ready for Saturday morning or whatever, that's what you want to do, okay? And obviously, one of you is going to call an
Yeah, and
ambulance.
don't stick anything in somebody's mouth.
No.
Nothing goes in
And
the
if
mouth.
you're alone, you could have mom hold the child on her side while you make the phone call. Because, so that you can utilize a parent for something that's not, a difficult
Now, does
procedure.
everybody, because when my oldest daughter had a seizure at 15 months, and she didn't have those jerking movements, she was like limp in her father's arms. Like, when he came-
Most of the time,
it was unusual.
well, most of the time they're tonic-clonic. Sometimes they're tonic, and then they just go limp.
Okay,
So
she might have
most of
been
the time
there
they're generalized tonic-clonic, but
That might present itself as more of an altered mental status, like the kid's limp and you're not sure why. I mean, that you could look that way with a seizure, you could look that way with a drug overdose, you could look that way a lot of or choking and you've passed out. So, but that would be altered mental status, and then you would do the same kind of thing, except for maybe you wouldn't know to put them on their side, but you'd still get them in a room and mobilize everybody the same way.
yeah, and you probably would anyway, because if they're like,
Yeah, because they may check their
Yeah.
airway, make sure they're not choking on, a big hot dog or something.
So maybe, Sue, can you be the front desk person and we'll do an asthma
Okay.
event, and you're going to be a known asthmatic.
Okay.
Okay?
Can I be this one?
Yes, you can. This is, okay. Yes, my child has asthma, I don't have her.
We're gonna come over, let's come into the treatment room. I'm gonna call a doctor. Okay. I need a doctor!
Sue, call 911. Make sure Dr. Cameron's on her way. All right, so all right, get the nebulizer. We don't have a nebulizer.
How old is your child?
She's 15.
15 years old, she's having an asthma attack.
Is that a nebulizer? It is a nebulizer. I don't.
Pioneer Valley Pediatrics.
Maybe her
We'll buy out too with the nebulizer, but the nebulizer is probably more important.
The protocol does say nebulizer.
Okay, the ambulance. I called for an ambulance.
oh my God, it's really hard to breathe that fast.
Send someone out.
We're making you better.
Okay,
Stop.
Chrissy, go outside and wait for the ambulance.
It's really hard to breathe that fast.
Oh my gosh, okay. You're getting better now.
Don't pass out. We
You're
don't want
getting
to pass out.
better. You're all better. You're getting better. It's really working. Very well. Okay, very good. Okay. And so she would also be getting an oximeter, putting an oximeter on her. She's listening to her. If there's not a doctor there, then Lauren would be doing the vitals.
Yes.
Okay, all right. Are you better?
Yeah, that was.
God, you're having a bad day.
So if you had a patient in the waiting room whose mother says, "Oh, I'm itchy and starting to get hives," you don't want to whack them with an EpiPen.
Right.
Because they could just be having hives from anything.
Right.
If they said, "Oh my God, I'm breaking out in hives. I have a peanut allergy. I left my EpiPen in the car, and I just had a cookie that had a peanut in it." That's a different thing.
Or if they come in, they're breaking out in hives, they're vomiting, they're swelling.
Yeah.
Then EpiPen.
Okay. Then EpiPen. But we have IBQ
They're both in ours.
right now. So, and you'll get a chance to do this, but it says on here over and under 55 pounds, and it's written on the bottom here. So you want to wait and you want to know which one you're gonna choose. Okay. The blue is for baby. It's not really baby, but that's how I remember. It's the young one. Okay.
Our emergency book for Long Meadow is going to be at the front desk on the shelf where the card is, so that everybody will be able to access it. In the past, if we've had to evacuate the building because the toaster oven set the smoke alarm off, we have met in the back parking lot near the dumpster. Apparently, we have to be 100 feet away from the building. So from now on, what we are going to do is our meeting place is going to be in the front of the office, out by the mailbox. So you're gonna go to the edge of the parking lot. That's where we will all meet. So if there's a fire or there's some kind of an emergency that we've had to evacuate the building, first of all, we wanna make sure that everybody is aware that we're evacuating the building, even if you need to use the paging system. And don't forget that Sue Martini is downstairs, okay? And don't forget the triage is in the middle. So if we're having to evacuate, the front desk staff should be responsible for the front area, the business office, and the people that are in the waiting room, and check the waiting room bathroom so that we make sure that everybody gets out safely. Triage and the clinical are going to be responsible for making sure that everybody, from triage back gets out. Doctors are going to have to escort patients out of the building if they're in a room with a patient. Once you have left a room and you know the room is empty, the patient and the parents or whatever have left, close the door, because that way we know that everybody's been taken care of. And again, check the bathroom in the back. Okay, so if there's a fire and it's in the middle of the office, and we've got some people going out the front, some people going out the back, go around the building and let's have everybody out in the front. If there is some type of an emergency in the office and we need to go to a safe place, so if there's a tornado, if there's a hurricane, any of those weather conditions that are coming that could be dangerous, and we have enough time, we need to come downstairs. We need to bring the patients with us, we've done that before, and make sure that we've evacuated everybody from the area. Nobody in an elevator. Okay, so no elevators, you can use both stairways to come down. If there's a problem in the office and we have a hostile person that's come in, patient or whatever, so far the only rooms that we have that we know lock, that have a lock on them, is the employee, the small bathroom, the patient bathroom in the very back of the office, the manager's office, and Anne Marie's office. Anne Marie's office has a window in it, but it does have a blind. So if you needed to get away from somebody and you needed to go to a safe place, those are the places to go. My recommendation would be to go to the manager's office because we have windows there. So if somebody had to get out, we could get out. Where are you going to meet in Enfield?
Okay, so this is what we're going to do in Enfield. Let me just stand so I can make sure. Our office obviously is much different than this layout, so we're going to have a whole different set of evacuation plans. When we are in Enfield, if there is an emergency within the office and we need to leave the office, we'll get everybody out. Triage people will be in charge of the waiting room and getting everybody out. The clinical people and the docs will be in charge of getting people out. That means utilizing the doctor entrance to the office as well. We want to go through the main foyer and out and across our parking lot so that we're on the edge of the street near Kohl's, that end of the parking lot near the front of the building. It keeps us far enough away, and I also want to be in full view of emergency vehicles when they come to help us. So I don't want to be tucked in the corner in the back. So we're going out the front, and everybody, and it's a small enough office, there'll be plenty of communication, but we want everybody to just kind of go right out. If there is an emergency on the outside, a weather-related condition, then everybody is going to have to come to the inside. Unlike Long Meadow, we don't have a basement. We need to use the innermost offices. Rooms 1, 2, and 3 are the innermost rooms. There will be flash lanterns I want in each of the rooms. They're not there yet. We will have our cell phones and chargers if necessary to use as communication tools. I'll have a radio with batteries as a backup so that we'll be able to listen to whatever warnings are coming out.
I want to touch base again about the whole telephone tree with the phone numbers. In the event that there's a weather storm, any kind of event that may cause us to wonder, geez, do we go to work today? Is the office opened? What do we do? The managers will hear from Anne Marie. Anne Marie is going to hear from the doctors. So the doctors are going to notify Anne Marie. Anne Marie is going to notify the managers. So each of the managers is going to let their staff know who is going to be calling them.
So next, I love these. All right.
They're awesome.
So let's look at the EpiPens
You guys look at it while
first.
she's doing it.
Well, let's look at the old ones first, because
Okay.
these are the EpiPens that we used to have, all right? Because if we need to use 2 of those, you're going to have to use one. We might need to end up using an EpiPen. See, very confusing. So you take the cap off, hold it, push, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, take it off. All right, so it doesn't talk. So that, take the top off of that, Carla.
This trainer contains no needle or drug.
Wait, listen to it.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1.
Isn't that awesome?
You're just fitting it right on there. You're just opening it up. You really only have to open a little bit. This tells you how full it is over here on this side. This one's 3/4 full. This is your LPM is liters per minute. Okay, so really all you have to do is you just open it up. Okay.
Blood pressure cuff.
So we have 3 masks that we're going to be using. And I'm only going to have this one out to show you. Okay. So you have a PD simple mask and an adult simple mask, which is basically looks like this, but it doesn't have the bag. All right. And then you have this one, which is a PD non-rebreather. So the only thing that makes it the non-rebreather is this bag on it. Okay. So what we've done is we've clearly labeled what you're going to use your liter per minute at on each one, okay? So a simple face mask is always at 6 to 10 liters. A non-rebreather, it's right on the package here, which I opened, is always a minimum of 12 liters because this is high flow O2 for somebody who's really in respiratory distress. All right, so this is high test. So all you have to do is once you've opened your tank and it's on, you're just taking the bottom end, put it right onto that tip there. Okay, and then you're just turning on your flow and go right to 12 liters. Okay. What's nice about these new non-rebreathers, that's what this bag is, a non-rebreather. So what's nice about these new non-rebreathers is it automatically fills up for you, but just so you know, you could run into an older non-rebreather that it doesn't automatically fill up on. So if you ever see that bag and it's just deflated, all you have to do is put your finger over where the white piece there, and it will fill right up on you. Because there's some that don't do it automatically. There should be another one of these plastic discs on the other side of this. That's what covers it up. So basically, with this simple mask, it doesn't have this disc here to cover it because when you breathe out, you're breathing out CO2. With this one, because it's the higher flow, so the premise of this is that you're getting oxygen in and out, you're getting higher flow O2. So that's it. Really? That's it. That's great. Okay? And then obviously, you just put a mask on just like that, okay? So I will let you guys open. I just also want to tell you that after you shut off your oxygen, when you're done with it, you're gonna take off your thing, but you need to bleed out your tank. So what you do is you just close the tank again.
I will figure that answer out.
To bleed it out, you just turn on where your liter per minute is, and a little bit more O2 is gonna come out. And then you just, because you shouldn't have O2 left sitting in there, because that can be flammable, so you're supposed to bleed it out.